Okay, well, kia ora and welcome everyone to the 1 hour introduction to RBA, or Results-Based Accountability. My name is Sharon Shea, I'm with Shea, Peter and Associates, and I'm working with MB in terms of the streamlining contracts with NGOs. Before we get started, I'd just like to acknowledge the author of RBA, or Results-Based Accountability. His name is Mr. Mark Friedman, and here are some website references for you to access post this training today. In terms of our objectives, we've got 3 objectives today. Firstly, we want to understand how RBA can benefit you, clients and also communities. Secondly, we want to learn about key RBA concepts. And I'll be talking a lot today about 237 from ends to means. You're going to love hearing those words by the end of the day. Key concepts associated with RBA, or results-based accountability. And thirdly, what we want to do today is just clarify the relationship between RBA and the Streamlined Contracting with NGOs initiative. So I often get a lot of questions about what are the benefits of RBA. So I just want to run through today with you 7 key benefits. So the first is it's simple and logical. You don't have to be an expert. And that's really critical in terms of the ease of implementation. And again, if you know the 237 concepts, you're away in terms of RBA. It is very easy to implement, and one of the key concepts here is having a common language. And I'm going to talk a little bit today about how a common language can actually enable us to have really rich conversations about outcomes so we can talk to each other, not past each other. A third benefit is tracking achievements, a really important thing moving forward in terms of outcomes-based contracting. So RBA enables us to evaluate the success and track and identify the achievements. It also enables us to identify contributions made to the community and government results and outcomes, which is a key thing for us moving forward. The fourth benefit is it is inclusive. It's an inclusive framework, and what we mean by that is we are able to engage with multiple partners in terms of outcomes-based contracting and achievement. And in particular, it's really great for collective impact, that is multiple stakeholders working together to improve outcomes. The fifth is that it's useful. It's a useful tool. It's great for planning, great for capability building, change management, and most importantly, performance improvement. So we'll talk a little bit about that in our time today as well. Also, you can, number 6 benefit, you can see where your efforts are making a difference on the ground in terms of client outcomes, but also how you contribute to the big picture in terms of population outcomes. And last but not least, RBA enables you to use data to drive decision making, and that's really critical moving forward as well. We've all heard of the scenario, the black hole reporting, where providers contribute their data to funders, but that data is never seen again, it's gone into the black hole. RBA enables us to overcome that process, or to overcome that issue, and move forward collaboratively together. Okay, so what we're going to do is learn about some key RBA concepts today, 237 from ends to means. So there are 2 key types of accountability and language discipline when we talk about RBA. So firstly, 2 key types of accountability, what are they? Well, they are population accountability and also performance accountability. So population accountability is really simple, everyone. It is about multiple stakeholders sharing the accountability for achieving results or outcomes for a whole population. And also what we do is we measure results and outcomes through using indicators. And indicators are simply pieces of data which enable us to measure whether or not results or outcomes are occurring for a whole population. A key concept about population accountability is that it's about multiple stakeholders sharing the accountability for achieving results or outcomes for whole populations. And I want to talk about that a little bit later on. Contrast that with performance accountability. So performance accountability is about client outcomes, okay? It's about client outcomes. And whenever we talk about performance accountability, we talk about performance measures, okay? We talk about performance measures, and I'm going to move on to that in a minute. But before I do, I just wanted to say that performance accountability is about, for example, a provider, agency or system holding the accountability for delivering outcomes to its clients. And that differs from population accountability because that is about multiple stakeholders sharing the accountability for delivering results or outcomes to whole populations. And again, we'll touch on that because that is a critical difference later in the 1 hour intro. So whenever we talk about performance accountability, we talk about performance measures, and there are 3 types of performance measures, everyone. How much did we do? How well did we do it? But most importantly, is anyone any better off? And the word anyone actually represents your clients, okay? It represents your clients, and that's the most critical performance measure in terms of measuring the success of a service program or initiative. And 7 questions, everyone, 7 questions which take us from ends to means, okay? So if we think about the ends as either a population result or outcome or a client outcome, what we need to do is work together to identify the means, e.g. how we're going to get there. So there are 7 questions in RBA which take us from ends to means, and what we also do through applying those 7 questions is we look at baselines and we look at turning the curve. And baselines is really simple. It's simply the baseline data associated with either an indicator or a measure, and it includes historical data as well as forecast data. And the term turning the curve, everyone, is a really easy way for us to identify, in terms of that baseline data, do we want the curve to turn up or do we want the curve to turn down in terms of our success linked to population results or outcomes or client outcomes. And at the end of the day, the ultimate objective is to make life better for our families, our whānau, our children tamariki and our communities. Okay, so let's have a little bit more conversation about RBA, and in particular the 2 parts of RBA, 2 types of accountability, population and performance. So population accountability, as we said, is about the well-being of whole populations, and it is about communities, cities, districts or countries. So for example, it is about the well-being of all rangatahi or youth in Te Tai Tokerau, which is Northland. It is about the well-being of all adults in Tauranga. It is about the well-being, for example, of all families in Auckland. A key issue associated with population accountability is that it is about multiple stakeholders sharing accountability for achieving well-being, results or outcomes for whole populations, and I want to talk about that a little bit more when we move forward. The other type of accountability, as we talked about earlier, is performance accountability, okay? And performance accountability is about the well-being of clients, okay? It is about the well-being of clients. And for example, it is the well-being of clients of teams, providers, programs, agencies and service systems. A service system, for example, is the health system or the education system. So it is about the well-being of clients, clients of services collectives, agencies or systems. As distinct from population accountability, performance accountability is about a provider, a program, an agency or a system holding the accountability for achieving outcomes for its clients. But remember, when we talked about population accountability, that is about multiple stakeholders sharing the accountability for achieving results or outcomes for a whole population. Okay? So we're going to talk about that more as we move through, because those are 2 key concepts associated with RBA: population accountability and performance accountability. So one of the great things about RBA is that we create a language discipline. So what we mean by that is that we actually start to have a common language about outcomes. So you and I already have a common language. We know that there are 2 types of accountability: population and performance. Population is about the well-being of whole populations. Performance is about the well-being of clients. But let's have a little bit more of a deeper dive into definitions associated with those 2 types of accountability. So again, we can have rich conversations and talk to each other, not past each other, about outcomes. So when we talk about population accountability, everyone, we do talk about population results or outcomes. And a population result or outcome is simply a condition of well-being for children, adults, families or communities. So I'll give you some examples here. All tamariki in Hamilton are born healthy, safe roads, nurturing whānau families and also a prosperous economy. So as you can see, population outcomes are high-level aspirational statements of well-being for a population. Now, in its own right, they are absolutely fantastic, but what we also need to do is we need to have an indicator or a benchmark, okay? So an indicator or a benchmark is simply a measure which enables us to quantify the achievement of the population result or outcome. So for example, if we look at the population outcome here, all tamariki in Hamilton are born healthy, an indicator of success for us might be the rate of low birth weight babies in Hamilton. If we're looking at the population outcome of prosperous economy, an indicator for us of success might be the unemployment rate. Okay? It's very simple, everyone. Population accountability, multiple stakeholders, sharing accountability for achieving population results or outcomes, and we use indicators to help us to quantify whether or not that population result or outcome is occurring. Performance accountability we touched on earlier. Let's have another look at this. Performance accountability is about an agency or a provider holding the accountability for delivering outcomes to its clients. And when we talk about performance accountability, if you'll remember, we also talk about 3 types of performance measures. And a performance measure enables us to measure whether or not a program, an agency or a system is working. And we talked about 3 measures, and they are how much did we do, how well did we do it, but most importantly, is anyone any better off? And remembering that the term anyone actually equals your clients, okay? The term anyone actually equals your clients. So is anyone better off is the same as a client result or outcome. Okay, so now we're talking about from ends to means, everyone. From ends to means, one of the key concepts associated with RBA. So you and I have just talked about population accountability and performance accountability, but let's look at the relationship between those 2 types of accountabilities. So if we look at population and performance accountability together, what we suggest is that population accountability, e.g. population results or outcomes and indicators, are actually the end point, okay? They're the end point. And performance accountability, which measures whether or not a program, agency or system is working, actually represents the means, okay? The means to the ends. So if you're looking at population and performance accountability together, we're looking at population results or outcomes as the ends and performance accountability as the means to achieving the ends. But there's also another ends and means conversation in here, and that is in terms of performance accountability. So if we just ignore population accountability for the moment, if we are just looking at performance accountability, the end would be the client outcome and the means would be the service delivery. Now, from ends to means, important concept, because what we do in RBA is we focus on the end and then we work out how we're going to get there. And if you recall in the 237, we have 7 questions which take us from ends to means. The ends are the outcomes, either the population outcomes or the client outcomes, and the means are how we work out how we're going to get there.